The human spine is an intricate marvel, providing structure, support, and flexibility. It is the central pillar of our skeletal system, allowing us to stand upright, bend, and twist. Maintaining a healthy spine is paramount to overall well-being and mobility. However, our modern lifestyles often lead to spinal problems. Factors like poor posture, sedentary habits, and inadequate exercise can contribute to a range of spinal conditions. Understanding common spinal conditions, their symptoms, and available treatment options is crucial for early detection and effective management. Fortunately, advancements in medical technology have led to the development of sophisticated surgical techniques for spinal conditions. Spinal conditions encompass a wide range of disorders affecting the vertebrae, discs, nerves, ligaments, and muscles that make up the spine. One of the most prevalent spinal conditions is herniated discs. This happens when the soft, jelly-like center of an intervertebral disc protrudes through the outer layer, irritating nearby nerves and causing pain, numbness, or weakness. Spinal stenosis involves the narrowing of the spinal canal, compressing the spinal cord and nerves, leading to pain, tingling, numbness, and weakness. Degenerative disc disease is characterized by the gradual wear and tear of the intervertebral discs, leading to pain, stiffness, and reduced mobility. Recognizing the symptoms of spinal conditions is essential for seeking timely medical attention. Advancements in technology and surgical techniques have revolutionized spine surgery, offering less invasive procedures with faster recovery times. Minimally invasive spine surgery, or MIS, has emerged as a game changer, providing a safe and effective alternative to traditional open surgery. Surgeons use an endoscope, a thin tube with a camera and light source, to visualize the surgical area on a high-definition monitor, guiding miniature surgical instruments with precision. This minimally invasive approach minimizes tissue damage, reduces blood loss, and lowers the risk of infection, leading to faster recovery times and less post-operative pain. Technological innovations like robotic-assisted surgery and computer-guided navigation systems continue to drive advancements in spine surgery. Section 4. The Road to Recovery: Navigating the Healing Process. The recovery process after spine surgery varies depending on the type and complexity of the procedure, the patient's overall health, and individual healing rates. Adhering to your surgeon's post-operative instructions and adopting a proactive approach to rehabilitation is crucial for optimal healing. Immediately after surgery, pain management is a primary focus. Early mobilization is encouraged as soon as it is safe, with a focus on gradually increasing your activity level as tolerated. Physical therapy plays a vital role in the recovery process, helping to restore strength, flexibility, and range of motion in the spine. Your physical therapist will guide you through customized exercises and stretches designed to strengthen your back and core muscles, improve posture, and enhance mobility. Occupational therapy may also be beneficial, assisting you in regaining independence in daily tasks such as dressing, bathing, and cooking. Section 5. Reclaiming your life. Improved quality after spine surgery. Spine surgery can be a life-changing decision for individuals suffering from debilitating spinal conditions that have not responded to conservative treatments. By addressing the underlying cause of pain, discomfort, and functional limitations, spine surgery can significantly improve quality of life. One of the most significant benefits of successful spine surgery is pain relief, reducing or eliminating the need for pain medications. Improved mobility is another key benefit, allowing individuals to move more freely and participate in activities that were once limited by their condition. The psychological benefits of spine surgery should not be underestimated, as alleviating pain and restoring function can improve mood and boost self-esteem. Individuals may find themselves more socially active, engaged in hobbies, and able to enjoy life to the fullest.